I think domain 6 is very important in a lot of ways in terms of professional development and professional growth. One piece of it, of course, that is ethics. I mean, most of the states in our region, or I think all the states that have prevention certification, require regular ethics courses, at least every 2 years, usually 6 hours. And that's really, I think, important in a lot of ways. One important way is that many of us are funded by state or federal dollars. So in one way, it's about being good stewards of public funding, is to make sure that the other 5 domains are really a lot about the science of prevention. And I think that the more well-versed we are and adept we are at implementing the science of prevention, the better stewards we are of those public dollars. But ethics is an important piece of it too. So we're not just performing our duty according to the science of how to do prevention, but we're doing it in a way that's not causing any harm, and that it's due diligence in the most ethically sound way as possible.
Ethics touches on all aspects of our work. The 6 principles in our code of ethics are non-discrimination, which includes a mandate really to continue our journey in cultural competence, which is not a destination, but a journey, someplace we're never there. An understanding of cultural humility. It's like, I need to know what I don't know. I need to acknowledge that. I need to attend to and be aware of my own unintentional biases. So the second principle is competence. So I tell folks when they're taking a course, I say, here you are, you're applying that principle because you're building your competence. The third is integrity. So the integrity of our services based on do no harm. So we really need to be clear about using evidence-based practice, also keeping relationships professional, which sometimes is more difficult in a rural community, but I need to understand those boundaries. And one of them would be, how I use social media, that I don't friend people who are participants in our program, and that I don't have a dual relationship as much as possible, with people on my coalition. People will say, well, a member of my coalition's a good carpenter and I need my kitchen remodeled. It's like, okay, well, you need to be open about that. And you need to really kind of be clear about, what those boundaries are. And then nature of services, and finally, professional responsibility.
And the great thing is that, over the course of a few years, we've been able to develop multiple approaches to training on ethics. So you don't have to take the same old ethics course every 2 years, because that can get kind of boring. But we've been able to develop an advanced ethics course for folks like me who've been in the field for 15 or so years. So when you get to a kind of a supervisor level or a director level, like I'm in, there are other ethical issues you have to consider, because now you're supervising prevention specialists. So there's other things that you have to consider on top of the ethics of implementing prevention programs.
The other piece of that is that we and it's related to competence, is that we need to be current. We need to know our stuff, all right? And when you think about like physicians, for example, we want them to be ethical. We want our physicians to be current in terms of, good medical care.
I think there's always so much to learn. It keeps you from being bored. It also allows you to bring something new to the table, especially around community organizing. If you always bring the same game to the table, you don't really offer anything new. So you always added value. I think there's always nuances to what we do. So you may not be doing, for an example, a suicide prevention program, but learning about suicide prevention allows you to be able to say, listen, we have these common risk factors, so even though our focus is on decision making, it also has components that will support suicide prevention, right? So maybe there's opportunity for collaboration there. So I think every time you have a chance to learn. I'm also a firm believer that professional development is what builds respect an opportunity because the career trajectory for prevention isn't like this linear. It's more what makes you valuable is what you know and your capacity and what you bring to the table. So you want to keep that as broad and as deep as you possibly can so that you're relevant in the field. There's more opportunities for you, and so that you don't get burnt out. I think that every prevention provider should take evaluation courses, not because they need to be evaluators, but when they work with their evaluators, they know what questions to ask, and they also know the product that they're getting is the highest quality product that they can get. Because if not, you're at the whim of whoever.
With the funding that we receive, the contracts we have, there's really specific deliverables that we're implementing, and maybe around underage drinking and maybe around specific substances. But as preventionists, I think it's really important for us to be aware of sort of the totality and the bigger universe of prevention issues. One example I would provide is the area of problem gambling, which is something that EdCare is involved in. We do prevention and treatment and recovery services around problem gambling, and it's a co-occurring public health issue with a lot of substance use issues like drinking. There's a lot of co-occurrence with underage drinking and risky adult use. So there may be the inclination like, why would I need to know about this? I'm never going to do a problem gambling prevention program. But it is very important because if it is an issue in our community, while we may not be providing that service, there may be others in our service area that are. And because it is a co-occurring situation, we may be implementing a program with young people and that issue comes up. We want to be prepared to provide resources for that individual or for that parent or for that family. So we understand enough about the issue. We don't need to know it inside and out. We don't need to be able to quote all the data. We need to understand it enough that, okay, I'm competent enough that I'm going to be able to refer this person to where they can go, whether it's to get a prevention program, whether it's to get treatment or whatever.
Well, I always set 2 conferences per year. Usually one is a New England one and usually one national one, if I have the resources available to me. So I do that at least twice a year because I want to be able to be exposed to people I'm not exposed to on a regular basis. And it could be that I'm going to a sexual health conference or a reproductive health conference. Suicide prevention may not have anything to do with behavioral health, but there are behavioral health components. I do a lot of work around HIV prevention as well, because there's a direct correlation between HIV prevention. A lot of the work that we did for opioid overdose prevention really started with the work that was really successful with HIV prevention. That was the foundation for it. So if you learned about this, the skills are transferable and the content's transferable. So there's some real opportunities there. So I try to keep on top of things. I do think it's hard to find space when you're trying to do your job to also make time to do that. I get that it's a balance. I think that that's one of the reasons why supervisors in the prevention field really need to make space for workforce development for staff. And I think funders really need to make funding available for workforce development and see that as a benchmark of success for prevention providers.
And then the third piece, which is a little complicated for some folks, is that we need to be advocates and for wellness. And that includes modeling wellness. That doesn't mean we need to be perfect, but it needs to be that if I'm going to work in this field or I'm going to be on a coalition, I need to be modeling for the community because, like it or not, people look to you and expect that you are going to be modeling what it means to be well. So the takeaways: the responsibility to advocate, the responsibility to be current in our knowledge and skills, the responsibility to attend to our own self-care, and finally, the responsibility to adhere to the code of ethics that is promulgated through the Prevention Think Tank Code of Ethics.